Hi everybody, it's Julia from Massage by Julia. And in today's video I want to talk about oncology massage and what it is and how it's different from other kinds of massage. And sometimes people ask me, and it's a really great question. So I've jotted down some notes. So oncology means cancer, and this type of specialty massage is for cancer patients, cancer survivors, whichever phrase that you like to use. It is okay for patients at all stages of treatment. A lot of times, even nurses and doctors, patients themselves, family members are really worried about, can that person get massage? Yes, as long as they go to somebody who's been trained in oncology massage and knows what they're doing. And this includes patients who might have quite low platelet counts or neutrophil counts. So that type of patient would probably be in a hospital, and some hospitals do hire oncology massage therapists, or the patient might be in their home. But as long as you have somebody trained in oncology massage, they know when it's safe to give a nice gentle massage to the cancer patient. Often the massage is going to involve lighter pressure. So if you've had a Swedish massage that can be a light pressure in and of itself, that still would be way too much pressure for somebody if they don't feel well and they're going through cancer treatment. One type of measurement that we use is the level of lotioning. We say the level of lotioning. So that means just enough pressure from the therapist's hands as if he or she were, or yourself, you were putting lotion on your skin. He or she's putting lotion on the skin. It's that soothing kind of pressure. Very smooth, very soft, okay? No pressure at all. You don't want to add load on the body, which means you don't want to add stress to the body. The oncology massage therapist needs to know a lot about the different types of cancers, treatments, medications, side effects, and areas of the body to avoid, such as, is there a scar somewhere? Is there a tumor somewhere? Have they had lymph nodes removed? Is there an open wound? Sometimes you need to avoid these areas completely. Sometimes you just have to stay a few inches away. That's part of the training for oncology massage therapy. Another idea to keep in mind is positioning. So that's positioning of the person on the massage table or in a hospital bed, their bed at home, their chair at home. Maybe they're not able to lie on their back or their stomach or their side. Maybe they can only sit up. They're not maybe comfortable in a certain position. They might need a lot of bolsters or pillows, and that's totally okay. The oncology massage therapist has to know what to do if the patient has a port or a PICC line or an ostomy bag or anything like that, any tubes or wires, and that's totally okay because we've been trained to work around them and it doesn't faze us. Something that's very important to know about is if you've had radiation. So the oncology massage therapist has to know, can I work in that area at all? Do I need to stay away from it? How many inches away do I stay? That's all part of the training too. And as I mentioned before, the therapist needs to know, has the patient had any lymph nodes removed? And if so, from where, how many? And what goes along often with oncology massage is something called manual lymphatic drainage therapy. We call it MLD for short, lymphatic drainage therapy. That is a very light treatment as well, done without any lotion. It's done with dry hands, and it's a rhythmic, very gentle stretching and releasing of the skin in different parts of the body to help the lymphatic fluid come up and drain into 2 veins at the throat. Some of the positive aspects of oncology massage is simply what I call positive touch. A lot of times the cancer patient has to go to a lot of doctor's appointments. It's stressful, it's a negative situation. They might get poked and prodded. They have needles and lines and cables, and it's very stressful for the body and the spirit and the mind. So soothing oncology massage adds a positive way of touching the body and helps the person to feel like they're okay again. Another benefit of oncology massage is reduced pain and anxiety. Something I did not include is also reduced nausea. That's been shown through research as well. Better sleep, improved mood and quality of life, improved range of motion and mobility. Lots of good things for oncology massage. On the next page, I wrote down how you can find a qualified therapist. So that is probably the question in your mind right now. The first place I would suggest somebody were to go is from an organization I'm a member of. It's called the Society for Oncology Massage, and their website is s4om.org, Society for Oncology Massage. There are a lot of really great articles on there, and also there's a therapist finder directory on there. If you can't find somebody through that, then go to the website massagetherapy.com. It's easy to remember. And again, lots of really good articles about health and massage. But there's a finder service right on the first page where it asks you to type in your zip code. And then on the next screen, a list of qualified therapists in your area will pop up. And then at the top of that next screen, you can filter the results by modality. So modality means what type of massage. Is it geriatric massage or sports massage or pregnancy massage or oncology massage? So when you get the list of therapists, look at the top and it says filter by modality, and there's a list you can click, whether it says cancer massage or oncology massage. And you'll see then a smaller list of just those therapists close to you who have proper training, okay? And then we were talking a minute ago about some cancer patients need or want manual lymphatic drainage therapy. And this is a wonderful new list to find a qualified, certified lymphatic drainage therapist, or with sometimes lymphedema therapist, if you have lymphedema as a result of your cancer surgery. Instagram.com/lymphatic professionals. So these are all really good resources. Something I want to add at the end is just to stress how important it is for the cancer patient to see a therapist who has training in oncology massage. So I would not suggest that the patient go into a chain massage establishment because they might not have any training, and you definitely don't want to have a really deep massage either while you're in treatment. That is sometimes confusing to either an untrained therapist or the patient. They think, well, if I've got chemo drugs in me, I want a real deep massage to get the chemo drugs out. And that is the last thing you want to do. It's just is too much for the body. You're going to feel really, really sick afterwards. You need very gentle, soothing massages until several months after you've completed your treatment. So no deep tissue, I'm sorry. And then one last thing, I'm a mobile therapist, so when I go to people's homes and meet them for the first time, I have them fill out a health intake consent form. And It asks questions such as, have you ever had a massage? What type of cancer did you have? Did you have radiation, chemo, reconstruction? And do you have any other health concerns such as arthritis or diabetes, or all these questions? Are you exercising? Are you stretching? And from that short form, I get a really good sense of their health status, and that helps me know how to work with them on the table or wherever they are, their chair, their bed. For example, somebody might have had cancer, maybe they're still going through treatment, but they feel strong and healthy, they're back to work, they're back exercising, taking care of their kids just fine. That person is very different from the client who is feeling really weak, low energy, has a hard time getting up out of bed, has a hard time showering and dressing, they're not at work, they're exhausted a lot, they don't really have much of an appetite. Obviously, my touch for both is gentle, but for this second type of patient is going to be very gentle, and I'm going to be very mindful of the fact that they already don't feel well. But all in all, it's a wonderful thing to get Oncology Massage, and I hope that you will try it or you will try it for your loved ones. Thank you.